So I got an email yesterday highlighting something that Admiral Joe Sestak did for one of his constituents. And one of the things I've always liked about Joe Sestak is one of the guys who in Congress was really always there to help his people. And this is another one of those stories of Joe helping somebody. This guy's daughter had a brain tumor. And the insurance company said, well, not going to do it. A couple of denials, this, that, or the other thing. And Joe went to bat for the guy and helped. I don't think that should ever have to happen, but I'm sure that this guy is thrilled that Joe did, which is why I've asked the Admiral on the program. Joe Sestak, thanks for taking time for us.
Good to be with you, Rick. Thank you.
So, I look at this story. You guys sent out this email of this Mr. Boyle, who, unfortunately his daughter had this condition, much like your daughter did. And you went to bat for him, and that's fabulous. But the problem I have is we have an insurance system that makes that or made that a reality, and I think that's wrong.
Right. You know what? At the time when this was occurring, I had just gotten out of the Navy. I had to take care of my daughter with a brain tumor that only 8% of kids have ever survived. She's now 14, and this was very close to me when he approached our office. This was before the Affordable Care Act was passed. And what we have is a system where the insurance company is between the doctor and the patient, and they were denying her care for some of the side effects leading to blindness and other types of items. That my own daughter had to have some eye operations. The tumor had affected her optic nerve. And all of a sudden the insurance company say, no, we're not doing that. What? What do you mean you're not doing that? And we had to roll in on this as his representative in Congress. And so that's the type of effort that the Affordable Care Act was intended to take us down the road with, where they do not any longer have the insurance company between the doctor and the patient.
But, you look at the Affordable Care Act, and one of the knocks against it is still holds up that private insurance model. So I'm curious your thoughts of the recent dust-up between, I shouldn't say between Hillary and Bernie, but the dust-up that Hillary's kind of propped up, claiming Bernie wants to destroy the Affordable Care Act and Medicare and CHIP and all of those things.
Well, I don't think there's any effort by Bernie Sanders to destroy the Affordable Care Act. I think without a question he sees the great value that has come about of it, including the decreases in cost, but now children aren't denied care just because they have a pre-existing condition if their parents switch a health care plan, for example. I think what it gets to is what is the best way to remove the high administrative cost, et cetera, remove the insurance companies, so to speak, from all the health care plans. And I think you're beginning to see some of that occur. Look, we had the public option in the Affordable Care Act. I fought hard for that. And then the Senate took it out. Right. It was meant to do exactly what Bernie Sanders, to one degree, was saying to us, that to begin to move us to where the insurance companies were no longer the dominant determination of what happens as they try to reap more profits. Now what you're seeing is two things. One, you're beginning to see that hospitals are beginning to band together, like in Pittsburgh, to remove the insurance companies from being between them and the patient. Number two, we were successful in getting co-ops into the Affordable Care Act. Those were actually the alternative to the sole public option, where there were 23 co-ops where they are going through challenges, and I'm happy to talk about that, to where they were non-profit, consumer-oriented efforts to remove because private insurance companies weren't permitted to be in co-ops, and to give affordable, much more affordable, because the administrative cost wouldn't be there, because all the profit gets turned back into medicine and consumer in these nonprofit efforts. And if those things continue to succeed, and some of them are now beginning to take off, but part of the problem was the Republicans cut off the government loans that were going to them, and all of a sudden the startups of them were much more difficult. But those that survived are beginning to make great benefits of doing exactly, of removing the insurance companies from being in the middle of a decision with you and your doctor and taking away their administrative costs.
I'm actually a pretty big fan of co-ops. I would like to see us go back to the days of community-based health care, where we had community hospitals and all of that, instead of this whole profit model where you've got privatized hospitals who are looking at the bottom line and not about the health of the community.
Rick, and even to add to what you just said, we in the House, we removed the law that was passed in 1948 that said health insurance companies are exempt from antitrust law. And that's why our Department of Justice says 94% of all health insurance markets in America, before we passed the Affordable Care Act, were actually non-competitive, because you can have a Highmark and a Blue Cross Blue Shield that control the vast majority, over 80% of all health care plans, and it's hard to break in against that. That's why we tried the public option, is you would be able to get that government loan, kickstart them up. You don't have the high administrative cost. They actually is a co-op, which is and you directly get to the patient with no insurance companies between them. By the way, the Senate put back in that law to say if health insurance companies are exempt from antitrust law. Can you believe it?
No, I'm not surprised. Look, I was never a huge fan of Senator Max Baucus, and the more I revisit the Affordable Care Act, the less of a fan I become. Even beyond that. But, I look at you're eventually running for the U.S. Senate, and Pat Toomey, the guy who's the incumbent right now, it appears to me, and maybe you know better, is that he's one of these repeal and replace guys who, take us back to the good old days of pay or die, because I haven't seen a real plan from him yet. I'm curious.
You have seen nothing from Pat Toomey except repeal and no. He has voted or submitted amendments or done some action in the Senate over 30 times to take away all or parts of the Affordable Care Act. Now, this is a senator who, when he was a congressman, on average, every day, 165 Pennsylvanians were losing their health care. As a congressman, he did nothing, as the equivalent of the population of Harrisburg lost their health insurance over 44 weeks. Every 44 weeks, the equivalent of the population of Harrisburg, he did nothing. What he didn't want to happen was actually have a government of, for, and by the people say, wait a moment, health insurance companies, you're not being fair. We're going to make fair rules of the road. Much like I rolled in for that one Mr. Boyle and his daughter, I was a government employee. I rolled in as a public servant to fix that one. What the Affordable Care Act is began, and you're right, it's not perfect, but began to move us to the rule where there are fair rules out there, and eventually, potentially, the insurance companies are finally removed, and you get that high administrative overcost, that profit-oriented incentive removed from the insurance marketplace.
Yeah, I mean, I was a fan of Medicare for all from the beginning. The idea of make that the public option. Let me fix a price. Let me buy it and let it compete. That to me is the barest of minimums of what we should do. But here's the thing. I mean, we've gotten really sold this idea, Joe, of this running government like a business. And I looked to Flint, Michigan. We just talked about the water situation there. To me, that's a reflection of this idea of we're going to run our government like a business, which is, we're going to save money and we'll externalize all the costs. And now it's going to cost the federal government millions of dollars, and people are going to lose millions of dollars in their health, and 10 people have lost their lives because we've got people running our government, a government of, for, and by we the people, with the idea that we want to strangle it and drag it in the bathtub and drown it. And that's insane to me, Joe.
Absolutely right. Here's the issue. At one time, Republicans understood that the government could help improve our economy. For example, President Lincoln, a Republican, said we need to have a new type of college because we're about to have the industrial age be born. And he established land-grant universities from whence Penn State came from. He said we need an intercontinental railroad, and Wall Street wouldn't invest, and he invested in it. And then you could have a Republican like Eisenhower come along, and he said we need an interstate highway system, and by the way, we need student loan programs, and he established it. He didn't do it for business. He knew that our businesses would profit from having, like Lincoln wanted with land-grant universities, educated, trained individuals coming out. And then you could even have a President Nixon that signed the Environmental Protection Agency Act so that we could actually have someone protecting our water. So you wouldn't have the Halliburton loophole that says EPA cannot come in today into Pennsylvania and see how fracking is hurting our water supply.
So let's go back to this healthcare thing, because to me, this is one of those main issues that I think every family grapples with. This idea of health security. I mean, retirement being something else as well, but health security being front and foremost. We've got a system in this country to where if you're healthy, you have a job, and that job usually gets you some bit of health care, but you get sick, Well, you lose the job, you lose the health care, and that's when chaos ensues. And I've been saying, no one should ever lose their home. No one should ever have to go bankrupt. And no one should ever have to decide between feeding their family or buying medicine. That just seems to be a baseline of where we should start, don't you think?
Without a question. Look, in the military, we give health care to everyone, not because we're liberal. We give it because we want to make sure that the entire family of that military member is taken care of. So when he or she is forward and we have to get bin Laden, boom, they don't have an abscessed tooth. But back at home, he doesn't have to worry whether his daughter all of a sudden has brain cancer. He has to worry about that, but he knows you've got a medical team ready to take care of it. Why do we do that in the military? Why don't we have that type of accessible, affordable, always there throughout the entire population of America? And you know what? The Affordable Care Act does take us major steps there, but so much more needs to be done, because now if you lose your job, you are guaranteed to have access to some sort of whether it's Medicaid expansion, and or you're having some sort of part-time income that you'll be able to pay some of your health care. But if you're in the Affordable Care Act, you can keep your health care. But there's so much more to be done because not everyone's in that boat.
Yeah, but here's the thing. I mean, you talking about the military. I hear so many messages out there. Oh, the system's broken. We should scrap it and go to one of these pay or die type for-profit systems. Which, look, I was never in the military, but I think it's a horrible idea. Absolutely a bad idea.
Right. Look, what we're doing there in the military, really, in my opinion, works. Let me just give you also the one example of how we can even do the system better. In the military, if you then say you're out there, you get an injury, and then you're out of the military, your benefits are then in the VA because you've had a service-associated injury. Well, the VA can negotiate for a certain type of drug to help take care of you, a pharmaceutical. It can bargain for best prices. But Medicare, because of a law passed approximately 2003,
Yep.
which Pat Toomey was voted for, can now no longer negotiate for best price. We lose, for our seniors, $123 billion a year in Medicare because Medicare has to take the price that's basically offered them by the pharmaceuticals. You can get a same drug at the VA for half price, often one-third the price that you can get over there in Medicare for much more because you can't negotiate for best price in Medicare. Can you believe it?
No, look, I mean, that was part of the Medicare Part D plan, as I remember, that came under the Bush administration. And I think it was 2006 that went into effect because, I remember at the time my grandmother going, oh, this is great. I'll be able to get some of my prescription drugs paid for. And then she found out about the giant donut hole in the middle, which kind of crushed a bunch of that. And look, at the end of this, for me, I go back to no one should have to make those choices between food and medicine or health care and anything else. It just seems to be a right to me, Joe.
Yeah, if I could end with one story that brings your point home. I needed to take care of my daughter. 31 years in the Navy, I needed, I had to get out and take care of her. I remember sitting in Children's Hospital. First, we had our first brain operation at Walter Reed, and they couldn't get it. They said, Joe, she's only got about 3 to 9 months. We just couldn't get it. And so we were able, with our health care plan, to take her to Children's. And with a health care plan, then they brought in a special doctor who was able to get it. And then she began her chemotherapy. But I'll never forget, she vomited 18 times the very first day. I kept records as a military guy. What can we do? And it was a tough, regimen. But she was there, and we felt she was going to make it. In that room was a young 2-year-old boy. His parents were there with him. He had just been diagnosed with acute leukemia, a blood cancer. And yet social workers were coming and going. You could not help but overhear as they did not have health care. And the debate was, how can we afford to keep them here? Are we going to be able to or not? My wife and I looked at each other quietly. We were going through hell with her, but I got to tell you something. We had health care, and they did not. That's what drove me. When I had to decide what to do to run for Congress. My daughter was saved by this nation and the taxpayers taking care of us right there in the military health care plan. But that young boy should have had the same opportunity I did, and that's why I ran for Congress.
And that's why I hope people will take a look at your website, joesestak.com. We've got a link at thericksmithshow.com. And I think this is one of the issues that we still have to be talking about and moving forward to fix what's wrong with the Affordable Care Act and make it better for the future. Simple stuff. Joe, I appreciate the time.
Thanks, Rick. You have a great day.
Great talking with you, Joe Sestak. Again, check out the website, joesestak.com.